How to recognize a suspicious lesion on your foot is so important because the feet are vulnerable to skin cancers when they are exposed to the sun. Hey everyone, welcome back to my channel. My name is Deidré if we're meeting for the first time. This video is part of a two-part series. So the first part, we will talk about the skin briefly and the common types of skin cancers that can be found in the feet. And then I'll share a personal story. In the second part of this series, we will go over a case study of a patient who presented with a non-healing wound that turned out to be cancerous. So make sure you come back and check out that video. Alright, so let's first look at the skin. There are two main layers of the skin. The first layer being the epidermis. Now the epidermis is the thick outer layer that you can see with your eyes, and it's made up of 5 different cells. And then you have the second layer. The second layer is called the dermis, and the dermis is where you find all your oil and sweat glands, hair follicles, blood vessels, and nerve fibers. The first type of skin cancer that can be found in the feet is called basal cell carcinoma. Now, the basal cell carcinoma is the most common type of skin cancer, and it usually affects areas of the body that is mostly exposed by the sun. So you have your head, your neck, your face, your ears, your arms, your elbows, your legs, and your feet. Typical features are, it looks smooth in appearance, painless, can be sometimes tender to touch, and then there might be some bleeding on the area. The second type of skin cancer is called squamous cell carcinoma. And this typically occurs when the skin has been exposed to sun for several years. So we usually see this in patients who are elderly. And it usually presents like a scab, so it looks kind of scaly. And then if you remove that scab, then it looks red and it looks inflamed, and it just looks like it's not healing basically. Then the third type of skin cancer is called a malignant melanoma. Now this is the most serious type of skin cancer. So a malignant melanoma is a pigment producing cancer of the melanocytes that's usually interrupted or disrupted by the environment, such as the sun, and if you like to cook on sunbeds. And also it can be disrupted by factors such as genetics. This is usually seen in individuals who are 15 to 34 years of age, and usually in females more than males, and the skin type is usually very fair. Early diagnosis and treatment is essential. So knowing the A, B, C, D, E warning signs of a melanoma can help you to identify a melanoma early. A is for asymmetry. Is it asymmetrical or symmetrical? B is for border. Is the border irregular or is it smooth? C is for color. Does it have different colors? Is it brown? Is it black? Is it red? Or is it pink? D is for diameter. How many millimeters is it? And E is for evolving. Has the mark evolved in the last few weeks or even in the last few months? So there you have it. Those are the 3 most common types of skin cancers that can be found in the feet. So since I've known myself, I've always had moles. I don't know if you can see them here on my neck, but I've noticed that they have evolved over the last couple of years, and especially because my son is pulling at them. They have increased in size over the last 2 years. Also, I've noticed that I'm getting marks on other areas of my body, such as my legs, and I also noticed one on my foot. So I went and got my skin checked by a dermatologist recently, but it all came back fine. However, I do have to keep an eye on the one on my foot because as a person of color, melanomas tend to present in areas of the body such as underneath the fingernails, underneath the toenails, the palms of the hands, and the soles of the feet. So I will be keeping an eye on that one on my foot, because if it changes in size, all the things we've just discussed previously, if any of those changes, then I have to go back and get that checked immediately. So the take-home message is be sun smart. If you are going out into the sun, don't forget your feet. Make sure you put sun cream on your feet. The higher the factor, the better. So use something like 30 plus. And especially if you are a person of color, it doesn't mean that you are exempt from wearing sun cream, and it definitely doesn't mean that you're exempt from getting skin cancers. Yes, being of a darker skin tone gives you that extra little bit of protection. However, you can still burn, I burn, and you can still get skin cancers. So I've just been checked by the dermatologist. Everything is good. So remember, be sun smart. If you see anything that looks suspicious or hasn't been there before, especially if you are someone of color, get your skin checked. I hope you found this video valuable. Let me know in the comments if you've ever had your skin checked and what were the results. Thank you for watching, and I'll see you next time.